Hello, I'm Dr. Jane Parnes. On behalf of my co-authors, I'd like to give you a brief overview of our article, Targeting TSLP in Asthma. In this article, we review the underlying rationale for targeting TSLP and summarize clinical trial results of treating severe uncontrolled asthma using anti-TSLP therapeutics, with a focus on Tezepelumab, which has recently been approved by the US FDA for the treatment of severe asthma without phenotype or biomarker limitations. TSLP, or thymic stromal lymphopoietin, is an epithelial cell-derived cytokine, or alarmin, that has been implicated in initiation and persistence of inflammatory pathways in asthma. TSLP is released in response to a range of epithelial insults, for example, allergens, viruses, bacteria, pollutants, or smoke. Given its position at the top of the inflammatory cascade, TSLP can exert broad influence over airway inflammation through its impact on multiple downstream innate and adaptive immune responses involved in T2 and non-T2 driven asthma inflammation. TSLP may also mediate structural cell effects that contribute to airway hyperresponsiveness and remodeling. Inhibition of TSLP is a novel approach to treating the diverse phenotypes and endotypes of asthma. Tezepelumab is a human monoclonal antibody that binds to TSLP, preventing it from interacting with its receptor. In targeting an upstream pathway and blocking TSLP, Tezepelumab reduces a broad spectrum of inflammatory cytokines and biomarkers key to asthma inflammation. This review article summarizes the results of the complete clinical trial program of Tezepelumab, assessing the efficacy and safety of Tezepelumab across different dimensions of asthma. Additional trials of Tezepelumab in other indications are underway. Results of the recently published Phase 3 Navigator study showed that Tezepelumab delivers clinically meaningful relief from exacerbations in patients with severe uncontrolled asthma across a broad population of patients and irrespective of baseline biomarker status, regardless of baseline blood eosinophilic counts, pheno levels, and IgE levels or allergic status. Clinical data further showed that Tezepelumab reduced exacerbations requiring hospitalization. Tezepelumab rapidly improved lung function and was associated with better quality of life as measured by patient-reported outcome instruments. Similar results for exacerbations, lung function, and patient-reported outcomes were observed in the Phase 2 Pathway study. Tezepelumab also reduced inflammatory biomarkers and T2 cytokines, consistent with TSLP effects on downstream mediators. Our article presents the rationale and the clinical effects of TSLP blockade on asthma outcomes, airway inflammation, lung function, and patient symptoms. Tezepelumab is a novel treatment option for patients with severe uncontrolled asthma that delivers clinically meaningful asthma relief regardless of phenotype.